When dealing with healthcare claims data, we are likely to encounter a lot of variety of goods and services. For example, it is very common for a hospital to have thousands of different codes for all kinds of goods and services. When analyzing the raw claims data in such cases, we risk ending up with tables and visualizations that are unintelligible. What we will often find in practice is that people will then simply resort to only analyzing and comparing, say, the top 10 most expensive services, or the services that together account for, say, 50% of total cost. This method is obviously not very accurate, because we will leave out a lot of relevant information. A much more refined approach is to assign the different goods and services to higher level categories. For example, we can reduce the hundreds of services that a medical specialist can bill into 3 high-level categories: consultations, diagnostics, and medical interventions. Because claims data is made for the purpose of billing and not for the purpose of research, such higher-level categories may not be present in your claims data. However, even if such categories are present in your claims data, the categorization may not be useful for your particular research question. Using the same example of a medical specialist, we may want to zoom in on the activities of doctors providing obstetrics and gynecology, commonly abbreviated as OBGYN. OBGYN is a medical specialty that encompasses the 2 subspecialties. Obstetrics covers pregnancy, childbirth, and the period after childbirth. Gynecology covers the health of the female reproductive system. If we want to analyze an OBGYN specialist, we may want to distinguish the billing data that is related to the childbirth from the billing data that is related to the female reproductive system. In such a case, the higher level categorization of services in consultations, diagnostics, and medical interventions is not meaningful for our analysis. Instead, we will need a different categorization of the services, tailored to OBGYN care. This example highlights that the act of creating categories will often be project-specific and needs to be flexible. For that reason, it may not be of any added value to embed these categorizations into the architecture of an operational database, nor in the dimension tables of the data warehouse. Thus, when analyzing healthcare claims data, we must always ask ourselves if we can reduce the variety of goods and services by assigning them to higher level categories. The act of categorization will generally require some domain knowledge. Moreover, it will often require us to look for relevant information outside of our data set. In the next videos, we will discuss a few tips for finding meaningful ways to assign goods and services to higher level categories. Thanks for watching.